So I'm Greg, and I'm here with Employee Health Injury Prevention. And so there are a few things I want to talk about that I think are obvious to us, but I know that when we are with patients and have to move things and patients, and we get caught up in the moment, we do the orientation for new employees also in the 8170 building. So a couple of things I want to talk about, and Nicole touched on it with turning and twisting, and you know this, but the facet joints in the lumbar spine are designed for us to bend forward and lean back. So even when you're in a good position and you're not taking a step, you're twisting and it's like wringing out a washcloth. There's a lot of stress there. So when you are with the patients moving, doing whatever it takes, make sure you take that step to get you in a good position, right? Knees slightly bent, and keep the back in the quote neutral position. Don't start tucking the pelvis and things like that. You can brace the core, the abs, but when we start to alter the pelvis, then especially if it tucks under, then it starts pulling on the ilium, the pelvis, and straightens the curve in the low back, so you put more stress on the discs. When you go to reach for something, and I'll use, what do you do at home with the dishwasher? We stand in front of it, we pull the door out, we pull the tray out, and we're doing this kind of thing. Whenever you have a situation like that, when you can get to the corner and open the door, then pull it out, everything is right here, instead of reaching over and putting that stress on the low back. So those are some simple things you can do. Even at, again, I'll use being at home as the example, at a kitchen sink, and we're washing dishes or we're brushing our teeth in the bathroom. What do? We lean forward. If you can, depending on the height of the vanity, the height of the counters, get your thighs up against it. And when you're leaning over, this takes more of it and not the low back. Okay? So those are some quote simple things that you can do. And I know it's easy for me to say this when we're sitting in here. It's a little bit different when you're with patients. You have to move them and things are a little more intense. So the other thing I wanted to talk about quickly is the low back, the upper back, and things you can do on your own to help take care of that. So when we are moving like this, the hamstrings tighten up. And one of the best things you can do on your own, if you have a tennis ball at home, is to sit on a hard surface, put the tennis ball under your thigh, at the hamstring, and flex and extend the leg. And if you move that around under there, get your body weight over it, you'll feel an aha moment at times. Sometimes you're not going to feel much. So move that through there and flex and extend to release the hamstrings. That takes stress off of the low back. The other thing we can do is for the upper back, we're doing this all the time, no matter what we do. So the pec minor tightens up, pulls everything forward. It inhibits the range of motion of the shoulder joint. So what you can do is get trying to see where I can do this. Actually get into the frame of a door, and you get a tennis ball, and I'm going to have my back to let's open this. So put the tennis ball right under your collarbone, use your body weight, lean against it, and then move that arm back and forth and up and down. You'll release this, okay? So that helps with the whole shoulder joint. Now, a lot of times people ask me what exercises they can do for certain things, how they can loosen up. You have to address both sides of the joint. So if you're loosening this side up, because we're doing this all day, then just do some simple scapular retraction exercises to strengthen the other side. So you always want to balance it out no matter what you're doing here. You want to release one side, strengthen the other side. And the last one, who has done a piriformis stretch when you're lying on your back, figure four, diagonal pull, okay? And a lot of times you'll lift this other leg up if you're on your back. If you have discomfort in the low back and you do that, you're going to push the low back into the floor. Again, reversing the curve. If there's any disc issue, you're gonna irritate that. And I can't tell you through the years how many patients I've seen that have low back pain. And I have friends who are PTs, yoga, Pilates. This is nothing, you see that taught that way in a lot of those classes. But if you keep both feet on the floor and do the figure 4 here without picking this other leg up, that is taking care of their back pain. So it's the piriformis that you want to address, because that rotates the pelvis every time we take a step, and that takes the stress off of the low back. Again, the lumbar spine is not made to rotate, a cervical spine is. So those are 3 things you can do, 3 or 4 things to do to help with the upper back area and with the low back area.